Welcome to the Health Links podcast, where we engage in conversations that promote healthier living. I'm your host, DJ Thatcher. In this episode, we have a rare three-peat, one of the few times we've had a guest back for 3 episodes. The reason is, well, it's because of your interest level. This is all about sleep health, and not just about how to sleep better, but more importantly, why, from a health standpoint and a metabolic standpoint as well. We have with us Dr. Dana Blalock, a dentist, a doctor of dental surgery. And Dr. Blalock, welcome back to the Health Links podcast.
Well, thank you so much. Thanks for having me.
Absolutely. Let's give our viewers a brief overview of the previous 2 episodes that we featured Dr. Blalock. One was in episode 39, going back to, I guess, maybe the COVID days that was, maybe 2020 or so. And we talked about the fact that you transitioned from general dentistry, as we would generally think of dentistry, into the whole world of sleep health. And in fact, you have this great practice, Sleep Better South Carolina. And so watch for that whole great story of how she transitioned into that. But in that, we talked about the fact that obstructive sleep apnea, the apnea or sleep apnea people think of, is not only something that's a nuisance, but it really is a medical problem, correct?
Yes. Of course, when we're sleeping, if our airway is narrowing or we stop breathing, then that means our heart has to work harder.
Okay.
It wakes your brain up. Your brain is saying, hey, wake up and breathe. So the more this goes on throughout the night, and the loss of good quality sleep will definitely affect your overall health.
Okay, well, that makes sense. So in that episode, you'll see that in more detail. And we also talked at that time about probably the most common therapy for it is CPAP, or that continuous positive airway pressure.
Yes.
With the tight mask, and people have the little things on their face for hours, the little marks on their face. And even back then, the compliance rate was not that good with those. And I think it's probably still the same, even with some of the newer interventions with CPAP. Is that a fair statement?
Yes, I would say it's a struggle for many patients. If they can get 3 or 4 hours a night, they think they're good.
Wow.
And medical insurance companies say if you wear it 3 to 5 hours a night, 3 to 5 days a week. But then what about the rest of the night or the rest of the week when you're not using your therapy? So I think it's unfortunate that this is a gold standard. So that is why I do what I do, is I tell my patients we provide non-CPAP therapy for sleep apnea and snoring.
Yeah. And in that first episode that we did, again, episode 39, Dr. Blalock talked about the oral appliances that are available to be used in place of CPAP. And we went into a lot of detail about not only that, but the fact that getting the recommended number of hours per sleep at night is important. And I smile because I'm like a guinea pig, because I told you I sleep about 5, maybe 6 hours a night, and I've done that since I was a teenager. So it's been a couple of years at least. But why that's so important? You broke down, too, the fact that as we sleep, we have those 3 different stages. There's the light sleep, and then there's the deep sleep and the REM, or what were they again?
Yes.
Okay.
We cycle in and out at different stages of sleep, about every 90 minutes.
Okay.
So if you have a short night of sleep, say you're 5 hours, you'll still get into some deep sleep, but then you have less of the more restorative and the REM sleep, or the dream stage.
Okay.
So it's important to hit all those cycles. Our body makes so many great hormones during the deep sleep, helps us feel better the next day, clears out the tangles in our brain, the little plaques in our brain. We create good hormones that help with appetite and diet. So it really is important to make sure you're getting a good opportunity. So don't be a DJ.
Right, don't do that. So the REM sleep is when we dream. That's that rapid eye movement sleep. Your eyes really do move?
They really do. When patients go in lab and they do in-lab sleep studies, they put sensors around this area, and it's measuring the eyes because they start moving side to side, and that's when they can tell a patient is in that stage.
Oh, interesting. That's one of the things was mentioned in that first episode about the sleep studies. Historically, they were done in a medical establishment or a hospital, where you're hooked up to all these different electrodes, and not really a natural way to sleep.
No.
And you mentioned at the end of that episode, that the home sleep studies are now what is the standard, I guess. Is that correct?
Yes, it's much easier. You're getting a better representative night of how you normally sleep. You're in your bed, you have your pillow, you have your blanket, you have your temperature or your bed partner, and you're going to sleep more naturally.
Okay.
Some of the tests that I use to check the effectiveness of their appliances may just be like a ring, and it looks kind of like a Super Bowl ring.
Sure.
So it's not very intrusive to their night of sleep. You wear it, you cover it up with your blanket, and you don't even know it's there.
Okay.
And so it just gives us more data, more information,
Interesting.
instead of having...
And during, what kind of data are you getting from those sleep studies? Somebody has that on at home. I know it's checking their oxygen level, but what else are you checking?
The system I'm using now uses an AI interface, so we're
Okay.
getting heart rate, we're getting oxygen levels, and then it can dictate or extrapolate different information, letting us know the stages of sleep. It uses their phones, microphones, so we know about snoring.
Oh, wow.
The only thing the rings don't do is tell us what body position. Now, there are other devices that have sensors that give us body position, which is important because many times you're going to have worse apnea, more snoring when you're on your back.
On your back. I remember you said that in one of those previous episodes. Yeah, for sure. Okay.
But
And
a lot of good information.
Sure. And we'll get into more detail here shortly about physiologically what's happening, why it's a problem if your oxygen level is dropping, why you're not sleeping properly, and so forth. So again, that was episode 39, the first time we had Dr. Blalock with us. But then in episode 76, she and I had a good conversation, and we went into more depth there about the fact that people are not compliant with CPAP. The hoses and the wires, and just getting up and running to the bathroom in the middle of the night is somewhat of a problem. And you walked us through, and that was the first video podcast that we did. You walked us through what the oral appliance looks like and how it's utilized and kind of the how-to features. So check out episode 76 as well. You also mentioned at the end of that episode about the Inspire procedure, which is a surgical procedure. And just for the benefit of our audience now, what is that all about, or what does that do?
So the Inspire procedure is an implantable device. It's done by an ENT surgeon. Goes around here, and every time the patient breathes, there's a sensor then that senses that, and it has a wire, so to speak, that stimulates the nerve that moves the tongue out of the airway.
Oh, interesting.
So
now, people aren't sticking their tongue out all night or anything, are they?
Basically, yes.
Okay, I wondered.
But they determine the right amount of stimulation needed to just get the tongue out of the airway so it's not closing off.
Okay.
And it's a wonderful procedure for those who can't tolerate CPAP or can't tolerate an oral device. It's great for those who have some mental disabilities where it would be hard to get them to wear that.
Right.
And patients have gotten good results with that.
You mentioned previously that as a medical professional, you fully support CPAP and the Inspire procedure. And you said, yet the patients don't. Is that meaning they're not compliant? Is that what you mean?
Right. I always like to say, I am not against those therapies.
Sure.
I just hear from patients all day long their struggles.
Okay.
Some of them feel like they're depressed because they know they're supposed to be using their CPAP and they just can't stand it. They don't want their bed partner to see them wearing it. They don't want the marks, like you mentioned.
Right.
And so that's why I'm so happy to be able to offer them, and it's a very effective form of treatment. I use it myself.
Well, that's a brief overview, rather, of the previous two episodes and what we discussed. So again, check those out, numbers 39 and 76. That brings us up to the latest, greatest now with what's going on. I know there's a totally new device that's available. And so bring us up to speed on where the practice is. I know you've expanded now. You're in the Charleston area in West Ashley, but also now in Bluffton in addition, correct?
Right. I was seeing patients in my Charleston office from Bluffton, Beaufort, Savannah. And then I thought, there must be a need there. Yeah. So I opened a small satellite office there almost 2 years ago, and I have an associate there, and we're open Mondays.
Okay, in Bluffton.
In Bluffton, and it is able to get patients from Savannah, Beaufort, Hilton Head.
Sure.
Yeah. A great
Now, to be clear,
population.
you're a doctor of dental surgery. You're a dentist. those practices now, you're not going to go there to get your teeth cleaned or any of the dental procedures.
No,
It's
sir.
all about sleep. And so what do you physically do in those practices? Like if I'm coming in as a patient, I've had some sleep disorders. Are you doing the sleep studies there, or what types of things are you doing?
We are not. When we see patients, they have already been diagnosed
Okay.
by their physician. They've had a sleep study. They've been diagnosed. They've been
okay.
told they need treatment. We get those referrals, and then I have an insurance coordinator that figures out their insurance benefits.
Okay.
And so they come to us, and we, of course, explain what we're doing. We explain how the appliance works, and we take digital scans of their teeth.
I see.
I do some measurements. I do an airway exam. Many times we do a 3D image of their airway.
Okay.
That lets us know what might be contributing to their sleep apnea or their snoring problems. And then from there, we send the scans to our lab, and they manufacture their oral device, and we
Okay.
get them back 3
So they're
weeks
all
later.
custom fitted. Okay.
Oh, absolutely.
Interesting.
Yes.
So if someone is listening or watching right now and they think, well, I'm having trouble sleeping, I'm told I snore a lot, or I wake up, can they come to you directly, or should they be referred by a primary care physician, or what's your recommendation
If
there?
you don't know if you have a problem, talk with your physician and ask them to give you a sleep study. That's
Okay.
the best thing to do, because I'm not going to treat somebody unless they've been diagnosed.
Sure. Well, that makes sense.
I know of others who may just put an oral appliance in somebody's mouth, but that's kind of like a ER physician putting a cast on somebody's leg without having a diagnosis of a broken leg.
Sure. Makes
So I
sense.
think it's important to have that conversation with your physician.
Sure. Now, I know the original oral appliance that you're talking about was something that when you first described it, I thought, I've got a one of those mouth guards.
Right.
And I have some dental trays for whitening my teeth, and I am like a less than 0% compliance rate with those because I'm a light sleeper, and anything in my mouth just bothers me. I just can't fall asleep with it. So when you first described it, even though I know it's custom fitted, I thought, I'm not sure that would be comfortable. But now I know there's a second generation type of appliance. And these are officially called mandibular advancement devices. Is that
Yes,
correct?
yes.
We say oral appliance, but what's the latest that you have here that you brought along? And we'll also
I'll
provide some photos here too.
Yeah, I'll talk about this, but many of the appliances now are very small, very thin.
Okay.
So our patients, yes, you have something on your teeth, but they're not bulky. And I always tell my patients, once you wake up and you think, oh my gosh, I slept so well, you won't want to sleep without
Yeah,
it.
I bet. So what does the appliance, whichever one it is, what does it actually do inside your mouth or inside your airway? I know it's a mandibular advancement device. That sounds pretty high tech, but what is it actually doing?
So basically, we're keeping the lower jaw from falling back. By doing that, that keeps the tongue out of the airway.
Sure.
Kind of the same idea as the Inspire, moving the tongue out of the airway.
Okay.
How it's done is just different styles of appliances.
Okay.
Some have little wings that rest on each other. Some have bars. Some have hooks in the front. This is something I'm talking about here in a minute, but you can see it just has little wings that rest against each other. And this is what keeps the lower jaw from falling back.
Okay.
Now, the one I'm holding is the one I wanted to tell you about.
Yeah, this is a pretty high tech. The RPMO2 device. Is that right? I looked
Right.
that up. It's the remote patient monitoring of oxygen, I guess. If I got that right.
Yes.
I geeked out on the internet. So,
Good job.
Yeah.
So, how many people wear an Oura Ring or a Fitbit or
right.
a
I got
watch
mine, yeah.
to track your sleep and your oxygen? Well, this takes it to the next level. This is a medical device. We're getting oxygen levels. We're getting oxygen desaturation levels, pulse rate, hours of wearing the device.
Wow.
So it is like a sleep test unit in your mouth. It's also known that getting your oxygen saturation from a peripheral area is not as accurate as central, meaning in the mouth.
Yeah.
So that's another benefit of the accuracy of this device.
So it's transmitting to an app on your phone?
Yes.
And then it can then be accessed by your provider like you?
Yes, yes.
Okay. Are you monitoring this all the time, or you can just pull up reports at random, or how does
You
that work?
can pull up a report. You go to the portal, you review, and you see usage, you see oxygen levels, heart rate levels, and then make adjustments to the appliance if needed.
Okay.
Share it with a medical provider if a patient has the need for it because they're a driver or a pilot like DOT or FAA, they can actually send those reports of compliance to their either the flight physician or their physician that's doing their
that's a huge point that I never thought of.
Right.
We're going to go down the route here in a moment about the actual health problems that can result from a lack of sleep and the low oxygen level. But I hadn't thought about the fact that people who have specialty licenses, the pilots, the truck drivers, school bus drivers, whomever else, if they're having a medical problem, they can lose their license, I guess.
Yes.
Is that correct?
And they have to show compliance. And in the past, we would have an appliance that had like a little chip on it. All that would give us when we put it on the reader was how many hours they wore it.
Okay.
Well, the chips, I always said I had a love-hate relationship with them. Like anything else, they could fail. They needed a new battery. So we would pull up a report and we would only have 1 month of data, and the patient then is having to figure out how to explain to their physician, okay, I've been wearing it, but I don't have data. So with this new device, it recharges every night. And it does come with a 3-year warranty, meaning after 3 years, we replace this portion and get all new mechanics, I guess.
Now, here in the Low Country, we
that.
have a huge number of airline pilots who live here.
Right.
Obviously, with the ports, the truckers, and train engineers and everything else. What would trigger their company to require something like this? If they're given a diagnosis of obstructive sleep apnea, that's reportable to the company, and then they have to prove that they're getting good sleep, or how does that work?
They have to prove compliance with their treatment.
Okay.
And unfortunately, it can be interpreted in many different ways.
You can come in with those marks in your face. That's why.
That doesn't count.
Doesn't count? Okay.
I heard stories of truckers putting their CPAP on their dogs just to say it was being used.
Oh, wow.
But that's not going to work.
Good luck with that.
So some providers just request them to do a sleep study to check the effectiveness of their treatment. Other providers want to see that they're using it at least 80% of the time. So unfortunately, that's still something that can be interpreted. But with this device, we have both. We let them know how well they're doing with their device as well as how long they're using it or compliant.
Do you find that some of these people just, because of all those issues, they just don't report anything? They don't go to the doctor in the first place. Maybe that's part of the problem. They're not.
Yeah, I can't really speak to that, but I know some of them, they'll just ask the patient, do you have sleep apnea?
Yeah.
Instead of, you look like you have sleep apnea, or let's do a sleep apnea test because you also have high blood pressure and diabetes. Let's rule this health out.
That, right?
Yes, absolutely. Yeah. So I think I think they're a little more sophisticated now. But I had many patients say, oh yeah, they just asked me if I had sleep apnea or not. And yes, a patient can report what they want, but I think their eyes are more open now about the benefits of sleep.
Well, this looks really cool. So if I'm a pilot or a truck driver, I'm thinking, okay, this looks like something that is relatively comfortable. Let's hold that up again. That is so it's this kind of a soft rubber.
It's a hard acrylic. Let me tell you.
It's an acrylic, okay.
I mean, there is some flex to it.
Yeah.
But you would put this on your top teeth, and then you would put this on your bottom teeth, and it fits just like a regular one of our other appliances. There is a little more bulk here, and yes, this is in your lip area, so it's right there.
Sure.
Nice thing I kid about is there is a little red light there, so if you get up to go to the bathroom at night, you can smile and have a nightlight.
There we go.
No.
Too funny. Now, we'll have better images of this on the final production here, but it's just this black band that's there that has it looks like a chip, a computer chip, and that is what's transmitting to your phone, and then from your phone, you can send reports to your doctor then.
Yes.
Okay.
It's got all sorts of technology. There's so much that we can do with this technology.
Yeah.
The lab that does this is just incredible.
Wow. Yeah. So now, if I come in, I have a diagnosis of obstructive sleep apnea, you recommend this, especially if I'm a pilot or something?
Right.
We have this custom made. What's the turnaround time, roughly?
Normally 3 weeks.
Okay.
2.5 to 3 weeks.
Okay.
We get the patient back.
A few weeks.
Right.
Okay.
And during that time, if you're doing this, we get you set up with your app that will communicate with your device. Then when you get your device, we show you how to use it, how to put it on the charger. The minute it goes on the charger is when it transmits to your phone.
Oh, I see. So it's automatic. Okay.
Yes,
That's
and then also to the portal.
Okay.
Whether that be in my office or their physician's office.
Sure. I know
Yeah.
this just got approved by the FDA just this spring. Is that
It
correct?
did, I
So
think.
brand new technology or spring of 2026.
Right.
Yeah.
Yes.
So that's really interesting. Now, if I get this in, it looks kind of expensive. I get this in, it doesn't feel quite right. Can you make adjustments with that? Or how
Oh,
does it
yes,
work?
yes.
Okay.
And most of the time, a patient's insurance will cover the device, the oral appliance, which is nice, depending on deductibles and
Sure.
co-insurance. Now, if we can't get all the extra codes approved, there may be a small out-of-pocket add-on for this. But if you look at what patients may be paying for their Oura Ring subscription, in the long run, they're paying more for their Oura Ring than
That's
they
not a
would
medical
for this.
device, even though they're pretty
Right.
good. This
Right.
is really a medical device.
Right.
FDA controlled. So
Right.
interesting.
And the sampling rate on this compared to an Oura Ring is much greater, so it can be much more accurate.
Obviously, when we talked about the oral device, the only way to check not compliance, but check effectiveness of it was to do another sleep study.
Right.
And now you're getting a sleep study every night. So,
Correct.
yeah,
Correct.
Interesting. All right.
Because I would say that used to be one of the reservations for physicians and even patients. CPAP, you can get a report. How many mask leaks? How many events did you have during the night? Where the appliances, we didn't have that. So I would have patients say, well, how do I know if it's working?
Sure.
And of course, we find out after we do a sleep test or we ask them subjective symptoms. But this way we can let them know immediately or the next morning how their night looked.
Okay.
And that's another beauty of this technology.
Well, let's switch gears. So sleeping obviously is so important to make us feel well, to be alert, and to function during our activities of daily life. I mean, it's really a quality of life issue, but it's even more than that. We've done so many episodes recently about metabolic health and biohacks and things like that, things that people are looking for to stay healthier and live longer. And when we talk about the fact that when we don't get good sleep, we have all sorts of problems, such as with this insulin sensitivity or our glucose tolerance. What's the 10,000 foot level of that? How does sleep affect our sugar or insulin levels?
So I'll back up a minute. Think of our overall wellness as a chair with four legs.
Okay.
One could be your sleep health, one your medical health, one can be emotional health,
Okay.
and the fourth can be your physical activity. And if one of those goes away, what's going to happen? The chair is going to fall on the floor.
Right.
So if our sleep health is not good, then it can affect our overall medical health. We can find it harder to control our insulin. Patients become insulin resistant. We gain weight. Okay, we gain weight, then we don't have the energy to exercise. We have aches and pains. We don't feel like fixing a good healthy meal, and then we eat junk food. And then next we know we have diabetes, we have hypertension, and then I see patients on double medicines for hypertension when they need to get their sleep fixed, first of all. The other thing that can happen is patients are just tired all the time. And when you're tired, you can become depressed. So once again, from the health to or from your sleep health to your physical health to your emotional health. So it is all interrelated. A lot of people ask about weight loss. Well, what does that affect?
I look at this whole list here. Insulin sensitivity, glucose tolerance. Of course, the insulin helps the sugar get into our cells.
Right.
For those who are not familiar. Inflammation is a big thing. It's a leading cause of most diseases, heart disease and everything else.
Right.
And so when we don't sleep as well, we tend to be more inflamed. Is that correct?
Correct.
Okay. Which leads to obesity. We talked about diabetes, cardiovascular disease, the heart disease. How does sleep deprivation affect that? Is it the oxygen level dropping that can create cardiac problems or what?
It can cause irregular heart rate.
Okay.
And more patients who have AFib, which I have seen more patients since COVID.
Really?
So there has to be a correlation there. But
You think it's from the COVID or from the vaccine?
I don't know.
Who knows? Okay.
I haven't read
Interesting.
literature about it, but so many colleagues that I've talked to, we see it so often now with patients with AFib. So our wonderful doctors in town are treating them, but they know that if the patient goes, or if they're still having apnea events, they can go back into AFib because for a moment the heart stops beating normally, blood can pool, it can thicken, which then changes the rhythm in the heart.
Sure.
So,
plus, you're predisposed to blood clots, stroke,
Yes,
all those other
yes.
dreaded things.
So, as I say, it's a real thing.
So good night's sleep can help prevent a lot of that.
Absolutely.
So, yeah. I know that we talked about this before, but we've seen a lot of problems, at least the literature has seen it, with people who get less than 6 or 7 hours of sleep at night, where they have this fragmented sleep. It really messes with their circadian rhythm. And so forth. That's a big deal, I guess, especially for shift workers and things like that.
Yes, as far as missing sleep or becoming sleep deprived, studies have shown that if you're driving sleepy, you are just as detrimental as someone who's driving under the influence of drugs.
Yeah.
And it's a pretty scary thought when you think about shift workers. Well, shift workers normally are pretty disciplined. If they work from 12 o'clock at night or early in the morning until 6, they know then that when they come home, they have to go to sleep. And others, though, when they have swing shifts, they work nights, they work days. I don't know how they do it because it's so hard on their overall health.
I said it's a root cause of my sleep, I think, for 7 years.
Oh, sure.
On call in hospitals. You work sometimes during the day, the night, the evening,
right.
whatever.
Yeah, so, I think the nurses, when they used to do that to them, it was the worst thing ever.
Right. Yeah. Yeah, long time.
But it does change your regular rhythm. We know that the sunlight cues our body that it's time to wake up. When it gets dark, it's time to go to sleep. And if you're missing those cues, it's hard to get on a regular sleep rhythm.
I don't have that, but yet I don't maybe sleep as well as I should. I know some recommendations that are out there, and let us know if these are really good or not. One is to eliminate or reduce really the light exposure. So make your bedroom as dark as possible without the night lights or the sleeping by the TV.
Yes,
that's
absolutely.
Okay, so have the lights turned off because having lights on can increase the insulin resistance, I heard. That's interesting correlation there. But,
and I know my husband thinks I'm crazy when I say this. There are sensors in our skin that will communicate with our brain, and even though our eyes are closed and we're asleep, we can see the light, and it is cueing the body to change the circadian rhythm. In other words, if your skin sees light, it will make you think it's time to start getting up. And so that's the importance of the dark room. Now, granted, sometimes you're in places and it can't be dark. I think eye masks that block out the sun or the light are very important.
Right. We had a doctor on here a few episodes back talking about metabolic health, and one of the big things that he rallied against was looking at these things before bed. The blue light that comes from the phones and so forth. We might think it's relaxing, and even because I argue everything, I argued, well, I read on this. I've got books, and so forth, but it's still that light that's entering your brain, and it's keeping you awake, I guess. It's stimulating your brain. Is that correct, or what?
That's what they say.
Okay.
Now, many people then you can counteract that. You can get the blue light blockers shades for your glasses.
Okay.
So if you're using that at night, you're not being exposed to it. I even had a screen on my phone that was a blue light blocker.
Oh.
Because I can watch Netflix right until bedtime and then go to bed. But it is definitely a problem for some. They wake up, let's say you wake up in the night, they pick up their phone, and so there's more stimulation from your phone and the light, so it continues to interfere.
Sure.
So I normally recommend if a patient wakes up or they're trying to fall asleep to just use a regular book. Go analog. Get paper.
The actual paper.
Don't pick up your phone.
That's great.
And then some other sleep hygiene tips that I talk to my patients about all the time is time your dinner time. I like to say I'm eating like an old person now. If I can have dinner at 5, I'm great, because then I have a good 4 hours, at least 4 hours before bedtime, because our body needs time to metabolize that food. Another thing is alcohol. People think, oh, okay, I'm going to have a glass of wine before bed because it slows me down, when in fact the sugar in the wine and the alcohol wears off and can wake you up and cause you to have a poor night's sleep.
There's a lot of studies and a lot of people, medical professionals, whether it's on YouTube or wherever, they talk about this, that, hey, stop drinking and eating 3 hours, at least 3 hours before bed, because you often are waking up at 3 a.m. It's when your insulin is spiking and so forth. And in retrospect, I was doing a lot of that, waking up at 3, and I normally get up by 5. So it's like not too long before I would naturally get up. And I started doing that where I cut back, where I don't eat, within about 3 hours.
Yeah.
It does help. It's interesting.
And in Charleston, if you go to dinner at 4:30 or 5, you can
always get
a
in.
table.
Yeah. A lot of our favorite places, they only have reservations at 9 or 10.
I know.
Unless you're going to bed at 3, it doesn't help.
There's no way.
So,
then the other thing is caffeine. We all love our caffeine. But think about it. Caffeine has a half-life of 5 or 6 hours. So if you're having some at noon, 2 o'clock in the afternoon.
And half-life means that
the time it takes for half of it to wear off.
Okay. So like 5 hours.
5 hours. So, people will say, "Oh, it doesn't affect me. I can fall asleep." Well, they may fall asleep, but then again, you're waking up at 2 because all
wired.
the caffeine is still in your system.
Okay.
So I really recommend, cutting back on the caffeine. Having it in the morning. I'm all for that if your health allows you to have caffeine, but then be done with it for the rest of the day.
Let's give our audience, as we end here, maybe just some of the quick overview of, am I sleeping well? Am I not? What are some things they should be looking for? Like, number one, maybe a partner who's telling them they're snoring a lot, or what else?
Right. So I always talk to my patient. I treat the patient, not the number on their sleep study first.
Good.
So when we determine if they're getting better, the one question we'll say, well, how are you sleeping? How did you feel when you wake up? Did you wake up with a morning headache? Did you dream last night? Did you have to get up and go to the bathroom? And I know they look at me like, why is the dentist asking about that? However, if that patient or us, if we're not getting in the deeper stages of sleep, we're not creating that antidiuretic hormone. The concerns that patients have are about dementia and Alzheimer's. And again, it kind of goes back to that metabolic health.
Sure.
But we also know if we're not getting the deep stages of sleep, we're missing out what our body can do for us. So those are our big questions. We don't ask patients if they have dementia, but we'll ask them how they're feeling. Do they feel like they're remembering things? Or many patients will say, oh my gosh, this is life-changing. Some will say, I'm able to drive again because I was afraid to drive before I was so tired. Okay. So those are just easy things that if you are noticing that in your own day-to-day life, talk to your doctor about it. Ask for a sleep test.
Good.
And then we'll take it from there.
Terrific. And for people to get in touch with you, they've gone to their doctor. It is sleepbettersc.com, correct?
Yes,
and we'll put
that's
that link
correct.
down below
That's
here.
correct.
Anything else our audience should know as we say goodbye?
I can't think of anything.
All right, fair enough. Well, Dr. Dana Blalock, thank you so much for joining us.
Thank you so much.
Again, for a three-peat.
That's right. Great. Thank you.
Thank you for joining, and we look forward to seeing you in our next episode where we'll have another conversation where we promote healthier living. I'm DJ Thatcher. Thank you for joining.